Welcome to Dr. D.Y. Patil Medical College Hospital and Research Center. I am Dr. Anil Menon. I am head of Department of Endocrinology, and with me is Dr. Milind Patil, who's consultant endocrinologist at our hospital. November 14 is celebrated globally as World Diabetes Day. It is basically meant to increase awareness about diabetes among lay people. This year's focus of World Diabetes Day is diabetes at workplace. Globally, it has been seen that 7 out of 10 people with diabetes are in the working age group. Those people who have diabetes have to balance their health along with expectations of career. Hence, it is important for a person to understand whether he is an employee or employer about the impact of diabetes at workplace. So the slogan for this year's diabetes is know more and do more for diabetes at workplace. So let me start with you, Dr. Milind. What are the challenges patients with diabetes face at the workplace?
So this is very important question. There are multiple challenges a patient has to face at the workplace. So as you pointed out, this diabetes is a lifestyle disorder, and patient has to follow certain regular lifestyle. Like they have to take the diet on time, they have to do regular exercise, have adequate sleep. So balancing the work and the lifestyle is become challenging. The patient finds difficult to have food at regular time interval because their working shifts may be different. Then there is other challenges if some frequent traveling at multiple places. He may not get the proper food choices what he can have at home. Then the second issue is faced by taking the medications on time. Sometimes patient forgot the tablet to carry. Another important point is how to take insulin at workplace. So there are two issues in this aspect. One is how to carry the insulin to the workplace, and second, some people find it they don't have any privacy to inject the insulin. So another point is they're balancing doing the exercise. We generally tell the patient to have at least 30 minutes moderate intensity physical activity per day. But suppose if a patient is staying in Kharadi and his job is at Hinjawadi, half the time he will be traveling in on the road. So after going at home, practically it's difficult for him to do some exercise. He's completely exhausted. So I think these are the challenges at the workplaces. So with that, I will ask you, I pointed out the challenges. So what advice would you like to give to this individual who has work schedule, sir?
Yeah, so actually you are right about the work challenges. In fact, I'll give you an example of how work challenges affect diabetes. We had a person who came to us. He is a revenue collector, Talati, and his job involved traveling frequently throughout the day, and he found it difficult to keep a schedule with his work. So the most important thing one has to do is that you have to follow a regular meal pattern. That is the breakfast, lunch, dinner schedule that you have for yourself. Secondly, you should be taking your medicines in time. So I suggest that a person should put a reminder wherever he's working or on the move that now I have to stop, take my medicines, take my meals, and then continue. The third thing is that he should keep some snacks handy, which can be kept by them. The snacks can be in the form of chana or roasted makhana or some fruits which basically can be apple, guava, which he can take in between meals so that he doesn't feel the effects of low sugar. Those patients who are on insulin, it is better that you carry a cold pack with you wherever you travel and keep the insulin at the desired temperature, or even you can keep the insulin at the workplace if a fridge is available. So I think these are a few things that can be used to reduce the to keep a regular lifestyle and regular medical along with your diabetes. So, in continuation with me, with this, let me ask you a question: that if a person is a employer, or if he is an entrepreneur, or if he runs businesses, what should his approach be towards patients, or rather employees who have diabetes? You are likely to have employees who have diabetes. So, what should an employer have in his mind or consideration?
Yes, so employer has to understand few things, that diabetes prevalence is very high. So there will be few of your workers who may be having a diabetes. So be a little bit sensitive to these people. Diabetes doesn't affect the working capacity. People can work to their full extent with diabetes, except those who are having complications of diabetes like diabetic nephropathy, neuropathy. So there will be some limitations. But in general, a working diabetic person should not be differentiated from others. At the same time, they should be given little bit of freedom, like they should have freedom for food choices. If you are having mess in your company, you keep the healthy food option for their breakfast, lunch, dinner. The timely break should be there for breakfast, lunch, dinner. Provision for the taking insulin, that has to be there. Just like we found on airport the launch for the smokers, like smoking zone. So that kind of thing you can keep like some similar like that insulin zone where the person can go with dignity and take the insulin and come back and resume his work. Providing some recreational activities. Suppose if the work schedule is hectic and a person has to go and late night at home, before before logging his shift, he can do some exercise in the company premises. So I think with that thing and providing a proper health insurance to these people, I think these are the some options in my mind.
I think
Employers should
that's
follow.
correct. And even if you are an employee who is working and you have diabetes, so make sure that you follow the doctor's advice and also go for regular reviews. And as an employer, I think you should be more sensitive about the requirements.
Yes.
I think that's a message that we would like to give to all the people who are watching. And thank you for your attention. Thanks a lot.